Okay, so Dr. Gavin, I'm going to turn this over here in a moment. Dr. Gavin will be the first speaker, although the principal speaker today is Melissa Gross. She's a registered dietitian, chief dental hygienist, president of Health Promotion. Dr. Gavin, this is all yours.
So let's let's go straight to what we're going to try to accomplish today. We are calling this part two, and it's for a reason. One is because we want to add to the discussion that we started in part one, the focus of what it is to what's necessary to actually reduce the risk that is imposed by poor dental health or oral diseases on the chronic diseases that we talked about. So this is a continuation, and today we are fortunate that we are able to hear more fulsomely from Melissa Gross, who really didn't have a chance to, as we say down home, strut her stuff last time. But today, believe me, she will, as you'll see. So my role is really to set the stage for the presentation that she will be the principal presenter of. So what are our objectives today? We're going to talk about the basic principles that we introduced the last time, and then review the stages of progression of dental disease. Remember that gingivitis is sort of the earlier stage that you see gum disease, and then you can have a progression to periodontitis, where you have actually now the involvement of not only gums, but you can actually get bone and tooth disease that you'll hear about. Importantly, we want to talk about what's causing these oral disease processes and what's their link to the chronic diseases that are the focus of CHP's chronic disease program. What's the relationship between oral health and heart disease, diabetes, and things like cancer? The major thing that I want to do is to introduce the notion that dental disease is a risk factor for multiple chronic diseases. Now, we've talked in the past about risk factors for a variety of the chronic diseases that we have focused on. We want to talk about the protocols of how you diagnose, but then also how you treat and even prevent dental disease with the reduction of dental disease's impact as a risk factor. And that's what you will hear in Ms. Gross's presentation. And then finally, the resources that are available and the standards of care that we ought to be following. Next slide. So after participating in this activity today, our hope is that you will be able to understand what are actually risk factors for the various chronic diseases, and why should we focus even? Why should we spend any time on oral or mouth diseases as important risk factors for many of the diseases that are known to damage our health, like heart disease, kidney disease, diabetes, brain disease like strokes and Alzheimer's disease. We hope that you will also, at the end of this, understand what we know about the changes in the environment of the mouth and what some of the mechanisms are that actually result in oral diseases becoming a chronic disease risk factor. But most importantly, we want to make sure that you understand what you can and should change, why you should change it, the available resources that are there to help you, and Melissa will certainly be pointing out some of those, and how to modify the oral health risk factors that we carry in order to improve our overall health and to reduce the burden of major chronic conditions like heart disease, cancer, diabetes, kidney disease, and many others. Next. So let's go back by way of review to some of the things that we talked about in part one, to remind you that our mouths contain over 700 different species of bacteria and fungi, 700 plus. About 150 of these are found in healthy mouths. Now, not all of these are found at the same time in any one mouth. About 500 types of bacteria are known to be harmful. They live in our gums, on the plaques, on the teeth, between our teeth, and on our tongue. At any given time, a given person will have somewhere between 35 and 70 some odd different types of bacteria in the mouth. Some of them are healthy, others are harmful. Now, when harmful bacteria dominate, that's a condition that's called dysbiosis. And we're not shy from introducing you to new terms. Okay,
Amen.
we introduced this the last time. Dysbiosis. That's not something you want. Okay, the mouth, it turns out, is the most accessible gateway between the external world and our external environment and all of our organ systems, whether they are solid organ systems like our hearts, our lungs, our kidneys, our guts, and our liquid organs, blood. The mouth is the gateway between the outside world and those organs. Now, poor health of the teeth and gums contribute to development of chronic diseases all over the body. And it stands to reason that if your mouth is this gateway, this thing that invites the world into your body, either by what you swallow or by what you breathe in the middle of this graphic here, you see a tooth, and that represents the environment of the oral cavity. Anytime you get problems that start with our teeth, you can get tooth decay, tooth loss, periodontal disease. Remember, periodontal disease is a more advanced stage of dental disease. And then all of the other related conditions, bad breath, halitosis. It's not a benign thing. But remember, you breathe through your mouth so that airborne bacteria that originate in your oral cavity can get to your lungs. You can get these bacteria by gum disease and blood vessels being inflamed and becoming more leaky. You can get bacteria into your blood vessels. And now you get those same harmful bacteria traveling to different organs to give you things like heart disease, kidney disease, brain disease, and yes, diabetes. Next. And this is a blown up graphic. And I want to just call your attention to the fact that when we talk about the mouth as a gateway for bacteria, you say, okay, what's the gateway? If you look at this red arrow up here at the top
Oh,
by the head, that
oh,
says
Dad.
it goes into the mouth. You can get these bacterial strains going into the mouth. Well, what happens once they get into the mouth? Well, you can swallow them from the oral cavity, and that's what's called enteral. That means they get down into your guts. Or remember, there are all kinds of things that are going on in the oral cavity itself. We've talked about a lot of that already in part one. But when they get into the bloodstream, that's what's known as the hematogenous route, the blood-borne bacteria. And where do they go? They go everywhere. They get to the brain. Yes, dental disease is linked to Alzheimer's. They get to the heart. Dental disease is linked to heart disease. They get to endocrine organs like the pancreas. So, yes, dental disease can be linked to diabetes and other diseases, and to the gut, and to things like other cells that they can predispose you to cancer, and to joints like rheumatoid arthritis. Next. So, what we know then is that this very complicated chemical process that allows oral bacteria to get into your body, and they cause toxins to be produced. And those toxins are not friendly to us at all. Why? Because they start a whole cascade of events that result in inflammation. You know that anytime inflammation happens, it's not a good thing. Okay? And one of the places where inflammation can set up, just an example of one of the places, is in the joints. Rheumatoid arthritis. We talked about these processes of citrullination. Citrullination, I hate that word. But anyway, when it happens, it starts to cause inflammation in a variety of places. It could be in your joint, it could be in your heart, it could be in your kidney, it could be in your lungs. But once that process starts, it now springs into a variety of different disease processes. Next. So that makes oral disease, diseases of the oral cavity, teeth, gums, tongue, a risk factor for a variety of other events. So, a health risk factor is anything, whether it's a trait, a behavior, or an exposure that increases the likelihood of your developing a disease or an injury, or a poor health outcome. And risk factors include a variety of things that we talk about all the time: poor diets, smoking, lack of exercise, genetics, high blood pressure, abnormal lipids like low HDL or high LDL or high triglycerides, or environmental toxins like pollution. These are all risk factors. Now, some of these are modifiable. That means you can change them, but some are non modifiable. You can't change them. And we'll talk more about that in a second. We now know, and one of the reasons why we're focusing on oral health as a risk factor is that poor oral health and diseases of the mouth should be considered important risk factors for chronic disease. Next. So, when we look at this table, I want to focus on a couple of things. On the left, you'll see the different chronic diseases, and you recognize these as things that we've talked about at one point or another. The new addition to this topic of chronic diseases that we are adding is the last one, periodontitis. Okay, but when you look at the middle column, the known risk factors for these various chronic diseases, look at how that plays out. The known risk factors, just as an example, heart attacks, coronary heart disease, and atherosclerosis. We know what they are: high blood pressure, bad lipids, obesity, age, diabetes, genetics, smoking, poor nutrition, stress, but also what we know now, a risk factor for all of those chronic diseases that I just named: heart disease, atherosclerosis, periodontitis. Now, some of these risk factors are non modifiable. We can't do anything about them. You can't do anything about your genetics. Well, I was going to say you can't do anything about your age. Now, some people think they can. They spruce up. Sometimes they even get surgery. But you look younger, but you're still old. Okay. The fact of the matter is that there are some things that, once they are a risk factor, that are non-modifiable. The two in that category are shown here. Diabetes. You know what the risk factors are, but look at there. Periodontitis is a risk factor for diabetes. That's a two-way street. Periodontitis is a risk factor for developing diabetes, but poor diabetes control is a risk factor for worsening periodontitis. Okay, so it's a two-way street. And among the risk factors for that, age, race, and ethnicity. You can't change those. So we have to focus on the things that we can change, all the way up and down the line. So what you see here is that there's one risk factor that's common to all of these chronic diseases that we've been talking about. And what is it? Periodontitis. It's very common, but we just haven't really focused on it. Now we are beginning to see the importance of it, and I'm pleased that we're able to focus on this. So finally, periodontitis means that when harmful bacteria are in excess, when you have poor diets, when you do things like smoke, when you have poor oral health habits, when you have conditions like diabetes, now periodontitis can be made worse. But look at this. None of these are non-modifiable. With periodontitis, every last one of the risk factors that are known to affect this particular condition can be helped in some way. And that's a very important distinction. Next. So here we are. My last slide basically summarizes dysbiosis, which is the condition that happens when the harmful bacteria outweigh the beneficial bacteria. And that means that there is a loss of healthy, diverse bacteria. On the left-hand side, there are all kinds of things that we can do to diagnose it, to know that this condition is present. That's what you can, the diagnostic tools that are available. Start with the examinations that you'll get that Melissa is the specialist in doing. But what is important to us today is what can we do about it? How do we address this conglomerate of oral dysbiosis, gingivitis, periodontitis? How do we affect this dysbiosis in a way that can prevent its progression and can prevent its impact on these chronic diseases? Addressing the problem is now the focus. And it's for that reason that we are really privileged to have as our really featured speaker here today, Melissa Gross, who is going to talk to you about that side of this whole equation. Melissa, it's all yours.
Thank you, Dr. Gavin. So I'm going to start off here. It's very important to go to the dentist at least twice a year for an exam. For a healthy patient, it's recommended for 2 cleanings a year. Usually diabetic patients and periodontal patients usually go 3 to 4 times a year for a cleaning. I just want to also note that most people don't realize that gum disease is actually the #1 chronic infection in the country. That's how prevalent it is. So here I am is to try and help educate you on to how to prevent that, not just gum disease, but also tooth decay. You can go to the next one. So as a dental hygienist, people think that we're just teeth cleaner, that we just clean teeth, but we do a lot more than that. We try and work with your doctors, your medical doctors, also to keep your whole body healthy. We're all about prevention, not just about the teeth, but about nutrition as well. We do early detection, as you see here, for gum disease. We do that along with x-rays. We can tell whether it's just gingivitis, which is the reversible stage of gum disease. Once it starts to destroy the bone and the teeth, we get to the unreversible stages of gum disease. We also check for oral cancer. We take blood pressure. People always ask, why are you taking my blood pressure? Well, we're there to help diagnose undiagnosed blood pressure along with doctors. And along with that, I just want to tell you how it's so important, because there's been times in my career where I'm just going to give you 2 incidences where I had a patient come into my office. His blood pressure was like 200 over like 140. That would be dangerous for us to clean somebody in the dental office with blood pressure that high. So the first thing I did is I sent him straight to the emergency room. And from there, the next phone call we got was that he was admitted immediately and had quadruple bypass. Now, this is a man that didn't know he had high blood pressure and was just walking around. Anything could happen at any moment. Another instance, I had a patient that came in. His blood pressure was very high. He was a periodontal patient. His name was Manny. He would come at 8 o'clock on Wednesday every 3 months like clockwork. He would come in. He was smiling, a great man. I kept telling him, you need to go get your blood pressure checked. Go to the doctor, go to the doctor, go to the doctor. He would come in every 3 months, never went to the doctor. Unfortunately, in his case, he did not make it. He actually had a heart attack with his son playing basketball, unfortunately. So, we're here to help you, to help patients prevent these issues. And we're here to educate how to prevent. And we're going to talk about nutrition and diet and how to take care of your teeth. Go to the next one. Oh. So it is required, and I see that this happens very often in a lot of dental offices, that hygienists do not do the cancer screenings. And it should be done every time you come into the dental office. As you can see, we will palpate the neck. We check the sides of the tongue. The sides of the tongue are actually the most common place for oral cancer.
Can I say something,
and then we check
Melissa?
the oral mouth.
Can I say something? Yeah. Excellent job at this part of it. This is so important, guys, because it's like sometimes the doctors do not do a rectal examination to check out for prostate and for colorectal cancer. It's extremely important for you guys to understand that your oral hygienist, your dental hygienist, should be the one, but let's put it this way, they are the gatekeepers into the dentist, right? We have good dental hygienists. I won't see the dentist very often. I will stop, but thank you for saying that. It's very, very good slide.
Of course, thank you. I just wanted to also mention that I do tell my patients that they can do their own oral cancer screenings. Just, when you go to, they tell women that they can do their own breast exams. So you can also check your mouth. Next one. Okay, so these are the different ways. This is getting cut off here. These are some ways that you can keep your oral health healthy. Gentle brushing on the teeth, and I say gentle because a lot of people they brush too hard and they destroy the tissue and the gum tissue that actually protects the mouth from the rest of the body and the outside. Always use a soft toothbrush. You can go back. Yeah. Always use a soft toothbrush. Very important to brush before you go to bed to remove the bacteria between the teeth and the food that's been stuck between your teeth throughout the day, because the bacteria will feed on the food throughout the night, and that bacteria will produce acid that will destroy the teeth. And the bacteria will continue to grow throughout the night. And important also is because at night there's no stimulation, so you don't get a lot of saliva in your mouth at night, so your mouth tends to dry out more, which doesn't wash away the bacteria and the acids that are accumulating throughout the night. Recommended to use toothpaste that are high in fluoride. Floss at least once a day. Don't ignore your tongue. The tongue has about 60 to 80% of the bacteria that's in the mouth. And diet and nutrition is very important. Smoking and drinking are not recommended. The toothbrush is to be replaced every 3 months. And I also recommend to my patients that if your toothbrush doesn't have to be 3 months, but if your toothbrush looks like it had a bad hair day, then throw it out. It's not good anymore.
Good point.
Monitor your food and your sugar and acid intake. And with that, sugar and acid is very important, but it's not just what you eat, it's how often you eat. And the reason I'm explaining the sugar and the acid and how often is because every time we eat, the pH of our saliva gets acidic and it starts to weaken the teeth. And the more often you eat, the more your body is being attacked, your teeth are getting attacked by acid.
Melissa, can I just ask you?
Sure.
Can I ask you a quick question here? Because one of the recommendations that we often hear, and you might get into this later on, is the importance of eating crispy vegetables and fruits to prevent that very thing that one of those things that you just mentioned.
Yes, things like carrots and fibrous foods help cleanse the teeth while we're chewing, which was going to be in one of the next slides.
Okay.
Yes. So I wanted to explain also with the sugar and the acid, we don't, a lot of people say brush your teeth right after you eat. You do not want to brush right after you eat because it takes about 30 to 60 minutes for the pH of our saliva to balance and remineralize the teeth. So also, if the more often you're eating, the more your teeth are getting attacked by acid. Again, visit the dentist twice a year. As far as using mouthwashes, there's many different types of mouthwashes depending on the patients. Patients that have dry mouth, it's recommended to have stuff with mouthwashes that have stannous fluoride or xylitol. Those are the things you want to look for. There's obviously anti-gingivitis. There's ones that are specifically for dry mouth. If anybody has any questions, let me know because there's a lot to cover. There's a lot of different needs based on the patient as well.
Next slide.
This was supposed to be up higher. I don't know how that ended up there, but we also do an extra oral exam. We check all the lymph nodes and the glands in the head and neck. It's just another added preventative measure to help prevent, what we want to detect for any swelling or abnormal bumps or lumps that are underneath your tissue. So going back to oral health, very important, but also I want to reiterate, I want to go back to the importance of being preventative, because what happens is sometimes people get diagnosed in the later stages, and by that time they've already gotten the gum disease or tooth loss. And I've had patients in the past that have lost so many teeth that they have a hard time even chewing their food. And when you can't chew your food, the mouth is the first stage of digestion. So what happens if you can't properly chew your food? I've had patients that have had really bad stomach issue and gastro upset because they can't even chew their food properly. And if you can't chew your food properly, it's not getting absorbed properly as well. And obviously you have speech issues. You can't speak properly because of the tooth loss, or even having loose teeth from gum disease. A lot of medication. So when you go into your dental office, the first thing we go through is medications that you might be taking. What that does is it reads any red flags of anything that can increase your risk. So asthma medications, inhalers, allergy medications, those will dry your mouth out. With people that are taking inhalers, it's recommended that you rinse out with water immediately after. Hypertension, high blood pressure medications will cause gingival overgrowth, and as well as dry mouth, immunosuppressants, antidepressants. These will all increase your risk for tooth decay and inflammation in the mouth.
I know, Doctor, I know that Melissa had mentioned about, at least Dr. Gavin had brought up halitosis. Halitosis really is a big problem. Okay, I don't think I have it. If I do, people don't tell me I have it. But it's nothing like someone talking to you and face to face, and they got bad breath. You don't know how to tell them how to deal with that. Is there anything that you will say to a client or to a patient that you're seeing that has halitosis or bad breath?
Yeah, halitosis is usually more in the moderate to advanced stages of gum disease. And what that is the bacteria building up on the teeth produce toxins and sulfur compounds. And that's where that bad smell is coming from. And that, to prevent halitosis, is, again, brushing, flossing, water picking. I'm bringing up, I added this to the slides because a lot of people, about 20% of the people are actually taking GLP now for weight loss and for diabetes and for their overall health. This can cause dry mouth, erosion, and gum inflammation, and even the tooth loss. So when it's very common to have decreased salivary flow with these weight loss drugs. It's very common. One of the high risk factors of this is erosion, because a lot of people, the risk factor for that is also reflux, silent reflux and reflux. So what happens is the acids from our stomach come into the mouth, and that it's eroding away the enamel in the teeth, which increases your risk for decay. It weakens your enamel. So I recommend for those patients to make sure they're using xylitol. There's xylitol, which is in toothpaste. It's in tablets and rinses. That's going to help prevent that.
I noticed also, Melissa, that there are a number of questions, and I guess we'll hold off till the end so that you can answer some of these questions that's coming into the chat. We have a number of questions that are unanswered in the chat, so hopefully they'll be able to answer those questions. Okay.
Okay, again with the medications, gingivitis. These are just a list of common medications. Again, the gingival hyperplasia is the overgrowth, bleeding gums. Gums is obviously a sign of inflammation. Xerostomia, that's just another word for dry mouth. Gingivitis, again, inflammation. Yeah, I just wanted to give you an examples of some of the common things that you can do to help prevent dry mouth. And I'm reiterating dry mouth because I see it very, very, very often. Probably one of the most common complaints I get from my patients. And these are just multiple different types of products that you can use for prevention. They mostly all have xylitol in it, Biotine, the toothpaste, there's sprays, there's rinses. So I just wanted to show you, this is proper flossing technique. Also, a lot of people come in, and I've had 50-year-old people come into my practice, and not know how to floss correctly, never flossed correctly. You need to make sure you're going underneath the gums. I tell my patients, you take a long string about an arm's length, and what you want to do is you want to wrap it around, starting on one end of the floss, so you have control of the floss. You want to floss, go between the teeth. You want to make a C around the tooth, and you want to slide down underneath the gums to remove the bacteria that's underneath. And slowly work your way down the floss. There's also a water pick. A water pick is like a power washer for the teeth. You can also add medicaments like peroxide into that. Some people use mouth rinses like Listerine and add any type of antimicrobial so that you can irrigate underneath the gums with the water pick. For those people that can't use floss for several reasons, maybe dexterity issues, or they just have a hard time, or they would be more compliant using a water pick.
Yeah, I also found out that Melissa, that the water pick for me works really good. I have a major, shall we say, bridges and crowns, right? And you can't floss through that, because it's like everything is fixed typically. But above the tooth and that gum line, that water pick works wonders.
That, and they also have threaders, which is it's like a little needle, and you can floss the thread into that needle, which allows you to get underneath the bridge work too.
And while you're on that, is there a preferred time for flossing, a time that's better than others? Some people think right after eating. Sometimes people say wait a while. Is there such a thing as a preferred time
flossing you don't have to wait for. It's the brushing that's important. I tell patients, if you're going to skip any time to floss, do not do it at night, because that's when all the food and the bacteria is going to grow and sit underneath your gums and between your teeth and do the most damage.
Can you say that again? Can you repeat that again?
At nighttime is the most important time, because the bacteria and food that's been accumulating in your mouth all day will sit in your mouth throughout the night.
That's when you don't want to floss?
No, that's when you do want to floss.
When you do want
at
to floss.
Nighttime.
Okay. Yeah.
Yes, absolutely. Very important.
Yeah.
This is just a picture of healthy gums. Healthy gums are nice, pink, and tight. They do not bleed when you brush or you're flossing. Gingivitis, your gums are getting a little puffy and red. And then you have periodontitis. You can see the teeth are starting to look longer. You're starting to get recession of the gum tissue, and the gums start to recede because what's happening is the bone underneath is getting broken down. You're losing the bone to the teeth. And so what happens when the bone starts to break down, the gum's going to follow and go down with it. So you start seeing the roots getting exposed. All that black stuff that you see in the brown around the teeth is all bacteria. It's tartar, it's plaque.
Can people who are chronic coffee drinkers sometimes also get some staining that can look similar to this?
Absolutely. That could be stained from coffee, but that's also, you can see that's also bacteria and tartar. But yes, and also the more stain you have in your teeth, when you see stain on the teeth, it looks more smooth, but if you were to look at stain it microscopically, it's actually rough. And so what happens is it causes more bacteria to accumulate on the teeth.
So what's the difference, Melissa, between tartar and plaques?
Plaque is that soft, mushy stuff that's stuck on the teeth. It comes off very easily. You can rub it with a finger. It brushes off easily. But after a day, or even after 1 or 2 days, it starts to harden. So what happens is that the minerals from the saliva start to deposit into that plaque, and the plaque starts to harden. You can remove the plaque yourself at home, but once it turns into tartar, that's when you need to get a professional cleaning. You cannot remove that with flossing or brushing.
Right.
This is the most common way to brush. Telling what you want to do is brush the insides, the outsides, of course. You want to angle the toothbrush bristles at a 45-degree angle towards your gums, and you just want to do circular motions. And you have to spend at least 2 minutes brushing your teeth. A lot of people tend to miss their tongue as well. 60 to 80% of the bacteria in our mouth is on our tongue. So not just brushing and flossing, but to decrease the bacterial load in your mouth, you must brush your tongue.
How often do you brush your tongue? What would you recommend?
A tongue scraper. I'm sorry, I shouldn't even say brush. I should say people use brush, but you really should get a tongue scraper. A tongue scraper it's usually metal or plastic, and it has serrated edges on it. And what you do is you just take it to the back of the tongue and you just drag it forward like 3 times, and then you just rinse out.
And Melissa, there was actually a question here while you're talking about the tongue. One of our audience members says that you said that they could perform their own screening of their tongue. Would you go into a little bit more detail? What should they be concerned about when they look at their
So
tongue?
what you're looking at, you're going to bring your tongue out. You can pull it to the side, take a piece of gauze, cotton, something so you can grab the tongue. Look at the sides. What we're looking for is red, ulceration, white patches. The sides of our tongue should be all pink, but you also see some vascularity. So you're going to see a little bit of darkening. You'll be able to tell they're like blood vessels, capillaries, those types of things. But anything that's red or white or patchy or ulcerated should not be on the side of your tongue. If you do see it, anything that is there, because you could have a canker sore, and you can have something that's sore, maybe trauma or you bit it. It should be gone in 2 weeks. If something hasn't been gone in 2 weeks, that's when you need to have it looked at.
And does painful versus painless make a distinction, cause a concern?
You don't necessarily have to have pain. You won't always have pain. I've seen people with oral cancer that didn't even have pain at all, but then I've had people that had pain and brought them in because they were having pain.
That's kind of interesting too that you'd mention that, because in general surgery, we see patients all the time that do not have pain. Pain tends to be a late consequence of your cancer as it begins to grow and grow to the vascular compartment. Of course, you got nerve, artery, veins, empty space. So then once cancer begins to affect your nerve, then it's probably going to be a little distant. We call it metastasis typically. I'm not sure how it is, from the oral standpoint, but I know from a general surgical standpoint, yeah, pain is usually something that we don't find usually early. Pain is something that, put it this way, if you have liver pain, right? If you have pancreatitis, I'm sorry, if you have a hepatitis, right? The capsule of the liver expands. The nerves are within the capsule of the liver. So when it expands, boom, then you have pain. But that's a beautiful thing, that pain. We have liver issues. If you're yellow and have pain, painful jaundice is a good thing. Painless jaundice is not a good thing. Painless jaundice usually means cancer of the head of the pancreas, and proven otherwise. All right. Are you through with this slide, Melissa?
Yes, we can continue.
Okay.
We should be. Yeah, so this is just an example of the foods that are good for your teeth and bad for your teeth. Obviously, we know lots of junk food, right? But also acidity, like hot coffee, chocolate, everything you see to the right. Now, you see the lemon. Lemon's good. We want vitamin C, but lemon is also very acidic. So we want to have lemon. A lot of people start putting lemon in their water because it's a health kick. But what that's doing is they're adding more acidity to their teeth, and it's causing more tooth decay and demineralization on the teeth, and a lot of sensitivity. And obviously, the foods to the left are the things that, high fiber. Then you have the milk, which has calcium. Bananas, phosphate. Cheese is very good for the teeth. Broccoli also has natural fluoride in it as well.
So let me ask you a question then about the coffee. I know we have a lot of, I'm not a big coffee drinker at all. I drink tea, right? But let's say you're a coffee drinker. Does it make any difference if it's caffeinated or decaffeinated coffee?
No, it doesn't matter if it's caffeinated. But most people that drink black coffee definitely will have more staining on the teeth. And again, the staining is going to attract more plaque.
Yeah.
Got it. Okay, so now it's time for us to ask Melissa and/or Dr. Gavin questions. I'm glad this finished up right on time. We're ahead of schedule, which is great. I think that we're going to try to cut our webinars down to about an hour and 10 minutes at most, and I think this is a good way to do it. So, questions. It looks like Yolanda Gray has a question. Hands are raised. You can ask a question.
Yes.
I'm just.
Go ahead. Sorry.
No, go ahead.
Okay. Yeah, my question was, good morning. My question was actually two things. One, I'm a teeth grinder, and it seems like I've grind
Mm-hmm.
my teeth down really, really bad, including the front. So it's almost like my teeth are like on a sliding edge or whatever. So anything that
Mm-hmm.
you in for grinding the teeth,
Is there anything you got cut up? Is there anything, I'm sorry?
is there anything that you suggest that I can use or do to avoid grinding my teeth? I do have a teeth mouth guard that I use at night, but I still find
Mm-hmm.
still
Mm-hmm.
grinding, and sometimes my jaws are really sore in the morning.
Yeah, I what the nut guard's going to do is protect your teeth. It doesn't necessarily stop you from grinding, but it does absorb some of the stress on your teeth as well. Some people even do it during the day, working out, driving, they don't realize it. So you just have to be aware of when you're doing it. And if you're cognizant and aware that you're doing it, you can stop because it is very habitual as well. At nighttime, obviously, you can't stop yourself from doing it. But if you're doing it during the day, you can stop yourself from doing that.
Okay, so are there any medications or anything that I should take um, to actually help myself from grinding it at night? Because of course I don't know. Sometimes my husband wake me up. He's like, "Babe, you're grinding your teeth." And I'm like, "Wow." He said it sounded like I was eating ice cubes.
Well, I will tell you that I don't know of any medications that will stop, but Botox is a good option. It's obviously very expensive. I'm not sure if that can get something that can be treated from a
Hmm.
medical doctor if you're having symptoms of it or pain or TMJ issues. But that is definitely that's given a lot of patients relief. Botox for sure. I know it does not get covered through the dental office, but it might be covered through medical. Um, there are drugs that will cause you to grind, like antidepressants. Some antidepressants will cause you to grind your teeth too. So that's a
Hmm.
problem for a lot of people as well, and they're not aware of it. I don't think a lot of hygienists or health professionals are even aware that that could be causing grinding. And there's
Okay.
also sleep apnea is a big problem too.
Okay. Well, I sleep very well, so that part is not a problem for me. So, okay, cool. Thank you. Then my other question, real quick, is I have a couple family members and friends, and I also wear a retainer also, and have some friends who do
Hmm.
partials and dentures. So my question is, how do you properly clean the dentures and the partials? And the other question is Polident and Fixodent to actually keep the dentures um, on the gums, is that harmful? If maybe because when you're eating, does any of that actually go down in your throat also? Because sometimes they say
No,
they go.
yeah, I've never heard of that being a problem, to be honest with you. As far as cleaning them, they
Hmm.
have you can get these little ultrasonic cleaners. They're on Amazon. It's just a little container that you put tablets in them, and then
Okay.
you can put the retainer or any of the or night guard, any of them, any appliance you can actually put in there to help keep them clean. Or a toothbrush with like a soap. Don't use toothpaste or anything on it. Just a
Hmm.
very gentle soap, and you can just brush it with a toothbrush.
Okay, so maybe like Dove or something like that, like a bar soap, just brushing with that.
Correct. Correct. No, no,
Okay.
no, not Dove. Just get like a soft, like hand soap.
Okay. Okay, cool. And then so there's no problem with the Fixodent or any of that.
No,
Okay.
but
All right.
I do want to mention that it's very important to take those appliances out. A lot of people leave them in at night, and that's
Hmm.
not healthy.
Okay. All
So
right.
it
I'll
must be
definitely let
taken
them
out
know.
at night.
Okay, awesome. Appreciate it. Thank you.
You're welcome.
Next person has a question.
Somebody is
Hey,
mentioning biting
uh,
ice.
Go ahead about biting
Yeah,
ice crystals.
somebody asked,
Yes,
is
terrible
it
for your
bad?
teeth. Terrible.
You said, what is
Yeah,
that? I'm
no,
sorry.
biting ice destroys your teeth. Yes, biting
Really?
ice is not good for your teeth.
Really? Okay.
It puts what happens is when you're biting on ice, people don't realize how much stress they put on the teeth. And we can start putting fractures in our teeth. And I tell my patients a fracture in your teeth is like having a fracture in a windshield. So what happens is you start putting cracks in your teeth, and then you're chewing and chewing. And over time, those cracks are going to eventually start opening up and breaking your teeth.
Hmm.
On the other side of that,
Oh, good, Dr. Gavin.
I was just saying, on the other side, somebody asked, "What's wrong with eating a hot dog?" You had under foods that are bad for you. It had a hot dog. I must say, I was a little nervous about that one myself.
I
Let me back that
wouldn't
up.
be worried more so about the hot dog, believe it or not, other than the bread, because the bread is the part that sticks to the teeth and in between the teeth. So it's okay to eat a hot dog. You might want to rinse the bread off, though. Don't let it sit
Well,
there on
you
your
know,
teeth.
what's interesting there, Melissa, is that one way of dressing a hot dog would be to use something like sauerkraut, which is a very, very important probiotic, which, you know, helps the
Absolutely, probiotic.
beneficial bacteria.
So,
Absolutely,
so,
absolutely.
so Dr. Gavin is telling me right now, guys, that he enjoys a hot dog. So for him to justify eating a hot dog from a healthy standpoint, from your mouth standpoint, he puts sauerkraut on it. I bet that's what he does.
Well, I'm not going to apologize about it. I certainly do. And not only that, but I follow it with an apple or a carrot so that I can help
Okay,
clean my teeth.
okay, you got it.
Melissa, am I on solid grounds by doing that?
Yes, that's
Okay,
actually good. Never thought about that, but absolutely that does help.
thank
Okay,
you.
got it.
Yes, but
Anyone else?
just
Yeah, go ahead.
Pastor Carol.
Dr. Gavin, I think that's better than pickles.
I think you're right, Chris.
Whatever.
Very
Why,
spot
thanks.
on,
But,
Chris.
but wait a minute, I have a
Very,
question for
very.
you, Melissa. I have a
yes.
question. For those that go consistently, for those that don't go consistently to getting their teeth cleaned, okay? Those that floss, those that don't. But anyways, when they go in and you actually review that they have to have some deep scaling done. When they have deep scaling, what are the anesthetics or proper numbing the area? Because I noticed when I went to get that done, they are allowed to now do injectables and injecting the
Mm-hmm,
area. So do you want to
mm-hmm.
tell them a little bit about that? They might not know or they're unaware of it
Well,
for
the
scaling.
hygienist, yes. Well,
Deep scaling.
you can be numb, as if you were getting a tooth pulled or decay removed. You can actually have Novocaine, but there are a lot of other products on the market now where you actually don't need injections. I 99% of the time don't use that. There are gels that you can administer between the tooth and the gum into that space where you have the periodontal pocket that will numb
Right.
the pocket and the teeth underneath, so you can comfortably remove all the bacteria and the tartar that's underneath. Did that answer your question?
Yes, it did.
Very good. I have
Okay.
Pastor Carroll. He has his hand up for a while here. Pastor Carroll, I'm so sorry I
Yeah.
didn't see you.
No. That was good. Your wife question about scaling is actually what I wanted to. The question that I had because I know that people are nervous about getting their teeth. A lot of times that's part of it, and fear and the pain and the scaling piece. I was told to be mindful. You know, if I'm saying, oh, the hygienist might say, oh, I'll go light on you, and I might just use the floss, and I might not do the kind of scaling that I'm supposed to do because you're afraid. And I was told, no, that hygienist has responsibility to do
That's
that
right.
scaling and to do that. And sometimes people, because sometimes our disposition, we're uncomfortable. And then there's some hygienists that are like, listen, I got other patients, so let me hurry up and get this joker out the chair. And so you're not getting, and I just wanted you to kind of help us, the psychosis behind it. I mean, my youngest daughter she's 20, she'll be 21, and she's just frightened of the dentist. And I said, I need you to go and get your teeth clean. I need you to do this twice a year, but if you'll go once a year, but she just has a real issue. So I wanted you to talk about scaling. And so I'm glad you brought it up, how important it is when you're getting your teeth clean. And so for a hygienist just to say, okay, I'll just use some floss, and then you get up out of the chair, and they haven't done you any justice because they didn't do the scaling because you were scared. So I just wanted to talk about that.
It's funny because I tell people this all the time because they get very nervous. And after I'm done doing the scaling, I ask them, they're like, oh, it's not as bad as I expected. I get that all the time. I always say, because people never talk about the good experiences they have. They always say the horrible
Yes.
experiences that they have.
Mm-hmm.
And there are some hygienists out there that are really rough. There are. And I'd like to think that I'm gentle, I've been told. But so, yeah, sorry, I'm just reading one of the questions. It could be done comfortably, and I just think that I try and listen to my patients and pay attention to what their concerns are and when they're nervous. A part of our job is to put you at ease and to make sure you're comfortable. A lot of patients do like to have nitrous oxide, if that's the sweet air, the laughing gas that helps relax the patient. But I will say this, that if it doesn't get done, it's only getting worse. You know, it's not going to go away.
Yes.
So trying to avoid it is not going to be the answer regardless, because otherwise you're just going to end up in tooth loss.
Thank
Anyone else have a question like Karen Hill? She has a couple of questions.
And
Hi,
Stephanie Simonette also had her hand up.
Hi, thank you so much for having this presentation. It's so good. Melissa's my hygienist and she invited me, and I'm so thankful that she's here. She's taught me so much. One of the things that Melissa taught me, and if you can talk to it maybe, Melissa, is you taught me that I needed to brush my teeth in the morning when I woke up prior to having my coffee because of my pH. I think that would help everybody because that's something I learned from you, and I don't think a lot of people know.
Go ahead, Karen. Sorry.
Oh, did you hear me?
I
So
did, but you were asking me a question, or you just wanted me
Sure.
to?
I was asking something that you taught me when I was in your chair was about my pH when I wake up in the morning, and that I should take care of my oral hygiene before I have my coffee that you said was acidic. So I thought that would be great for everybody else because I didn't know that.
Yeah, I apologize. Yes, you want to get, because like I explained before, at nighttime, because you have a decreased salivary flow, the bacteria that is in our mouth is producing a lot of acid throughout the night. So waking up in the morning, first thing, rinsing out, getting rid of all that is all that acid and that's been sitting on our teeth throughout the night.
Okay. I'm gonna have in a moment here. It looks like I have Pastor Arthur Jackson III. He is definitely on. I see him in the background. I text him if he would give out close.
Stephanie Simonette's hand has been up.
Okay, Stephanie, go ahead.
Hi, thank you for this amazing presentation. I wanted to know, for someone who doesn't go to the dentist, and let's say they have some type of issue, like they're having a heart attack, or they have some kind of kidney disease, or whatever it might be, one of the chronic diseases, does a general medical doctor know how to look for those specific signs to know that, okay, the person has periodontitis, opposed to, oh, they have diabetes because they're eating too much sugar or something like that? Does that make sense?
Yeah. Can I answer part of that question? And then Melissa, I guess you can take it off after that as a physician.
And then I want to weigh in on that as an internist.
Yeah, because typically physicians, at least where I was trained at Cleveland Clinic back in Cleveland, Ohio, we was told to put a finger in every orifice. Okay. That means that you would definitely have an oral exam done. And I just love the way in which Melissa presented this, because it's something that I'm sure everybody can identify with. And that is how to do your own self-examination, like you do a self-examination if you're a female of your breast. And by the way, men, you should do a breast examination too. Men get breast cancer as well. And when we get it, it's pretty doggone devastating. But the bottom line of it is that checking your mouth, open up to see far as back as you can, the back of your tongue area. And as Melissa has said about, checking the inner part of the gums, check the lateral side of the tongues, right? And just check and look for coating. If it's something that looks like it's white and plaquey, it may not be what we call thrush or Menelia type thing. It could be, but it may not be. And does it bleed? These things all are indications that the doctor, your general practitioner, basically your GP, your PCP, should be doing those things too. If they're not doing those things, then I want you guys to start asking about, hey, doc, can we check my mouth? The answer is going to be yes, I can. But I have so many people out there waiting in the waiting room. So if you have that kind of doc, guys, it cannot give you the best possible care. You're taking your time out to see the doc's supposed to be spending time with you. And I always tell people this too on these webinars. I am your advocate. If you have a doctor that's kind of like that, y'all should have my number by now. Give Dr. Reynolds a call. I'll be on the case. All right, so but go ahead, Melissa. And I think Dr. Gavin has something to. Go ahead, Dr. Gavin.
Yeah, I wanted to weigh in on that very point that you closed with, and that is every time you go for a general exam
Yeah,
to your general provider or to your internist, they open your mouth. They ask you to open your mouth and say, you know,
yeah,
that is a prime opportunity for you to ask
yeah,
specifically, are there any concerns that you see about my teeth, gums, or throat? Tongue or throat, because you need to be a partner in this process. And don't let the exam be cursory,
sure.
where you just open your mouth, put a tongue depressor in there, and then you close it, and nothing is said or done. Let's make this an active and investigational, exploratory activity.
Mm-hmm. Thank you.
Okay, Pastor Jackson, could you guys lead us into a closing prayer, please?
Hello, can you hear me?
Yes.
So listen, first let me thank you so much, Dr. Reynolds, Dr. Gavin, Dr. Gross, for such an amazing presentation. I want to thank, of course, all of the various pastors. Pastor Phil Pother was on, and I know he had to log off earlier. Pastor Carol, the other faith-based leaders, all of the persons that were on this call. Thank you guys so much for volunteering your time to share this information. It was absolutely phenomenal, and look forward to the next webinar. It's going to be a very insightful, and I can't wait to participate. So let me just pray. God, our Father, we love you. We give you glory and honor. Thank you so much for Dr. Reynolds, the entire CHP conglomerate. I thank you for Dr. Gross and Gavin, these professionals for just lending their time and their talent to service your people. Thank you for all of the calls. I pray that all of our questions were answered. God, we pray that you would allow us to take the information and not just be a hearer of your word, but be a doer. We seek to have the most healthiest vessels possible so we can give you glory and honor to advance your kingdom on earth. Dismiss us from this call today, but never from your care. This I ask in Jesus' name, I pray. Amen.